So, welcome everyone. It's really nice to see you here on Friday afternoon. Finally, it's a glorious day in New York, and spring is really coming. Today, we're going to talk about mitochondria and overall health of mitochondria and states of dysfunction that sometimes brings clients to my office because many people suffering from multiple symptoms of mitochondrial dysfunction. They don't even know about that, but we're kind of discovering it usually during our interview. And another reason for this presentation is to show you how conventional medicine approach to fatigue or other symptoms is very different from the functional medicine approach. With that said, we're going to start and we'll talk about mitochondria. So those are their beautiful little organelles or energy powerhouses that are present in almost every cell of our body. And this is the organelles that produce the energy, and we cannot survive without those organelles because they provide us vitality and health. So we actually very interesting fact that we inherit mitochondria from our mothers. So this is how we can actually in genetic studies we can trace our heritage through the mitochondria and through their mother's DNA and genetic material. So you can thank your mothers for mitochondrial health that we get. So today we're going to talk about what are the mitochondria, why are they so important, and what is the difference between mitochondrial disease and mitochondrial dysfunction, which is much more common, and what are some causes and manifestations of mitochondrial dysfunction. So basically, what are the symptoms? How can we recognize the mitochondrial dysfunction? We'll talk about nutrients that are absolutely essential for mitochondria proper functioning. And finally, we'll talk about immune foundational program that we implement in our office. So, few words about the mitochondria. So, as you know, those are cellular structures that are critical for production energy and immune system activation. So, without mitochondria, we cannot actually exist. We cannot function. So, they convert the food that we eat, specifically fats and proteins and glucose, into so-called adenosine triphosphate or their energy molecule ATP, and that is actually produced about 90% of the body energy supply. So we take their molecule of their glucose or amino acids or fatty acids. Well, mitochondria will take it into inside, and through the series of the reaction will produce energy. There's energy currency, ATP. So this process is actually a very wasteful, so to speak. So when mitochondria produces ATP, it creates a lot of oxidative stress. It creates the waste product that includes not just carbon dioxide, but those free radicals. And this is just a byproduct of the energy. This is the cost and the price we pay to produce the energy. So, and this oxidative stress creates the rusting or rancid effect on our body. And that's what actually creates eventually death of mitochondria. So they kind of sacrifice themselves by producing the energy. They create all these free radicals and that burns them out. Okay? And that unfortunately ages our cells. So there you are as old as your mitochondria. And as fast as you can regenerate those mitochondria in your cells, that's how long you're going to be living and how much energy you're going to be producing. So it's all about mitochondria. And without ATP, we cannot exist because every single reaction in the body requires ATP. Few words about mitochondrial disease versus mitochondrial dysfunction. So mitochondrial disease is something people are born with. Those are usually genetic disorders, and they usually inherit it. except for few that can be due to the mutation. And mitochondrial disease is pretty obvious from their childhood. So it usually very much creates issues with progression of in development of the children, and it highly affects longevity of the patients. This is not something we see every day, but mitochondrial dysfunction, on the other hand, is very common, and we see it day in and day out. And we all probably experience mitochondrial dysfunction. We just recovered from it. But sometimes some patients will stay in that dysfunction. And it's related to increase in mitochondrial damage from either environmental stressors or internal stressors that lead to poor mitochondrial function and reduction in regeneration, because mitochondrial genesis or multiplication or reproduction of mitochondria in our cells is the process that happens all the time. Old mitochondria die, the new mitochondria are being born, and there's certain lifestyle that will potentiate either way, either exit outcomes from either more mitochondria will die or more mitochondria will be produced. So the following factors will alter the mitochondrial function, and therefore will tip the balance towards free radical production or those oxidative stress that I told you about. Things like increased stress will always will require for their mitochondria to produce more ATP and therefore increase the free radicals. Poor nutrition, because if we do have enough nutrients, we can always neutralize the free radicals if we have enough antioxidants, which is a part of nutrition. But with poor nutrition, obviously, we don't have those reserves and resources. Therefore, mitochondria will be suffering. Certain lifestyle factors, and we'll talk about those. Exposure to toxins, it could be environmental pollution, the pesticides, the herbicides, the toxic metal, the plastics, dioxin. The list is, I wouldn't have enough time for me to list all the environmental toxins that we're exposed to today in the water, in the food supply, in the air, in the cosmetic products, as well as infections. A lot of infections will affect our mitochondria and will cause the mitochondrial death and or retardation of the new mitochondria being produced. So that's why any one of you probably experienced cold or flu or viral infection, after which you just need to recover, and it takes sometimes days, weeks, or months to produce and regenerate new mitochondria. So infections are really notorious for killing our mitochondria and causing this oxidative stress. So, and of course, certain medications. And that's probably one of the most common reasons for people to feel tired, especially when they are on the polypharmacy. So with mitochondrial dysfunction, as I mentioned, the free radicals are the molecules that will damage the protein and the DNA and the fats, and they will cause cellular injury and accelerating aging. It's just like this rusted car, as you see on the picture. Mitochondria can be damaged by those free radicals, and that will increase their demand on the antioxidants in our body. So when the mitochondria are damaged, obviously there will be a significant reduction in their energy production, and as a result, cellular function will decline. And this is a really nice diagram that I sometimes use in my practice and in communication with the patient that shows where other mitochondria energy is the most important. What are the most energy demanding organs in our system? And of course, number one is our immune system. Immune system requires tremendous amount of energy to function properly. Our brain is probably the second organ that uses a lot of ATP those energy currency that we discussed. The liver is the next one, and the cardiovascular system that, for example, our heart that is pumping and contracting, pumping the blood and contracting 24/7 requires tremendous amount of energy to function well. So when we expose to the certain triggers, as you can see on this slide, stress, poor nutrition, negative lifestyle factors, toxins, and just simple aging, it will create decreased efficiency in the mitochondrial function. And that will create a lot of oxidative stress, increase in free radicals production, and decrease of oxidative phosphorylation, which is basically a process of ATP production. So if the healthy mitochondria create, let's say, 100 ATP per minute, right? I'm just giving you a general number here. The damaged mitochondria, or the mitochondria that are in stress, will produce only 15. So a lot of running on empty processes. And finally, when energy production is decreased, it will further damage the DNA, mitochondrial DNA, and will cause this rancid or rusting process by increased lipid oxidation and increase of protein damage within the mitochondria. And finally, it will create the dysfunction in mitochondria, reduction in the ATP synthesis, and mitochondrial dysfunction in terms of production of their heat. And therefore we feel cold, our circulation is not working as well as it should be. So this is all those factors are all linked together in the function of mitochondria. And interestingly enough, this is the list of the medications that can create mitochondrial toxicity. Probably one of the first medications that you need to be aware of is the acetaminophen, or famous Tylenol, that creates oxidative stress and puts unnecessary damage on the mitochondria. And then there's tons of other medication, even aspirin, even those famous statins that everybody's taking nowadays. I mean, a lot of people after age of 40 or 50 are taking those medications, beta blockers, metformin, multiple antibiotics that are causing mitochondrial dysfunction. So this is probably not an exhaustive list, but top 5 will be aspirin, acetaminophen, statins, antibiotics, valproic acid. So definitely consider this as a toxic factor when you're on the multiple medications. So what are the symptoms of their mitochondrial dysfunction? Obviously, chronic fatigue syndrome, because if you're not producing, we are not producing enough ATP, we feel tired, and all their bodily functions and cellular functions are diminished and decreased in efficiency. Fibromyalgia, body cannot get rid of the toxins, now everything hurts, right? And body's accumulating the waste products, oxidative stress is increasing, and now all your muscles are aching. Even allergies, asthma, and autoimmune disorders could be a result of their temporary or chronic mitochondrial dysfunction. Frequent infections. Remember, mitochondria are feeding immune system with the energy necessary for all our cells run around to identify the foes and their enemies and the foreign bacteria and viruses that are bad for us, and kill them. And if we don't have that energy, our immune system is sluggish. Migraines, headaches, chronic infection like Lyme. Mold illness is great reducer or toxin for causing mitochondrial dysfunction. Brain fog, and is so commonly occurring with people with mold illnesses, is one of the signs of mitochondrial dysfunction. But also a bunch of neurodegenerative diseases like Alzheimer's disease, Parkinson's disease are the result of mitochondrial dysfunction. So mitochondrial dysfunction is one of those important processes that lay in the foundation of many chronic illnesses, even cardiovascular disease or metabolic syndrome. It's all involves mitochondria. That's why mitochondria is we need to cherish them. We need to know what they like to eat. We need to know what nutrients they like we need to provide for the mitochondria so they can work longer and more efficiently. So how do we assess mitochondrial dysfunction in functional medicine? Those are probably the tests that you won't see in a conventional setting, but it's usually lab tests that include micronutrients evaluation. Remember, I told you that if we have enough B vitamins in the body, if we have enough antioxidants, if we not have enough omega-3 fatty acids and proteins, we're probably supporting our mitochondria in a much more significant way. So, but there's a specific test. For example, organic acid test, which is usually either blood or urine, will show us exactly how your mitochondria is functioning. It will show you almost every step of the Krebs cycle, which is their biochemical process involving energy production from the molecule of the glucose. So we see all those different metabolites in the organic acid test, what we call it OAT test, that will help us to identify where are you right now with your mitochondrial function and what nutrients might be missing. But it also can look at the toxins that can affect mitochondrial function and damage them. Things like heavy metals, mycotoxins or mold exposure, illnesses and infections like Lyme, viruses, Epstein-Barr virus, mononucleosis, herpes, human herpes virus 6, cytomegalovirus, CMV virus, and many other viruses. But also anti-nuclear antibody, which is a non-specific autoimmune marker that can show us that, yes, there was a mitochondrial dysfunction at some point if the anti-nuclear antibody is showing up in your bloodstream. So those are the lab tests that we use in functional medicine. But also there's a lot of good nutrients we can use to resuscitate our mitochondria and support them during the time of the stress. For example, N-acetylcysteine or alpha-lipoic acid. Those are the nutrients that will help to increase antioxidants, intracellular and extracellular antioxidants. As you know, N-acetylcysteine is a precursor of the glutathione, and it works as the intra and extracellular antioxidant. It also helps to activate T cells that are very important cells in your immune regulation. Alpha-lipoic acid is another beautiful antioxidant. It helps us to detoxify, and it helps with the oxidative damage. So especially for those patients, for those people who are present here, my patient, you probably already did the 3x4 genetic test that will tell me and tell you if oxidative stress or oxidative damage is there a vulnerable pathway in your genetic makeup. If that's the case, I would always recommend 1 or 2 antioxidants in a rotational manner so that oxidative damage can be quenched and neutralized. Acetyl L-carnitine is a great supplement that helps your mitochondria, instead of burning glucose for the energy production, utilize your fatty acids. Great supplement also to help people to lose weight, and also very supportive of the lymphocytes, which is their immune cells. And of course, omega-3 fatty acids that are so important to decrease the inflammation, decrease inflammation, and decrease oxidative stress, and support healthy cellular membranes. And of course, because the membrane is also part of the mitochondrial makeup, it's very important for the health of the mitochondria. Multivitamins are very important as well. So I will definitely recommend some of the multivitamins specifically for the mitochondrial health. B complex is irreplaceable and very important to build metabolic reserve, as well as it helps to produce energy through the Krebs cycle that I mentioned. And famous vitamin D. I mean, it gets so much publicity lately, vitamin D, that I probably don't even need to mention it, but it definitely helps with tightening the gap junctions in intestinal lining. So anyone with a leaky gut or suspicion to leaky gut should be on vitamin D. It has a immunoregulating and immunomodulating effect. It also helps with their hormone production. So it's definitely a very, very important nutrient. And there's no really good way to know if you have enough vitamin D or not, except for checking the blood test. And I just got a message from Medicare that they don't want you to be tested for vitamin D. I don't understand why. I think if we supplement everybody with vitamin D, we'll have less chronic illnesses. People would need less medication and they will have less hospitalization. So I don't understand why this relatively inexpensive test can be obstructed for use of in the conventional setting. Okay, so let's look at their case of their fatigue. And this is Mary, and Mary came to see me. She was 40 years old. She presented with fatigue, dry eyes, and constipation. So she is a very successful and very busy businesswoman, and usually spends long days at the office. Until a couple of years ago, she had a great energy, everything was great, but then she had a baby, and she had mastitis, which is the inflammation of the breast. And since then, she noticed that her energy was decreasing, and she started having brain fog. She can't work as efficiently as she used to. Now it takes her even longer to accomplish the same amount of work as before. And then she also reports that she had to take antibiotics for a long time because of this mastitis. So what did we do for Mary? So she was placed on the nutrient supportive diet, which we call mitochondrial diet or mito diet, and to help her with her fatigue. And then due to the frequent antibiotic use that she mentioned to me in her history, we decided to look at her gut and look at the intestinal permeability. So we gave her some supplements for gut and also did some blood tests, including their full thyroid panel, again, that anti-nuclein antibody test, which is autoimmune marker. Again, vitamin D level, that is so important for a good energy production. Food sensitivity test, and organic acid to really assess her mitochondrial function. She was instructed to work with a health coach and read some materials about how the lifestyle affects our mitochondria and energy production in the body. And also, we gave her a couple of tools of stress reduction because she's now have extra responsibilities in her life. She has a child, she's not feeling well, and she still needs to continue to run her business. So this is the supplement that Mary received. She got omega-3 fatty acids to decrease the inflammation and support healthy cellular membrane structure and promote healthy immune function. She got a multi-strain probiotics because she just had a tremendous damage to the gut microbiome due to the antibiotics intake. We gave her a great multivitamin. She got some homework to do to work with a health coach and understand the principle of energy production and schedule the lab procedures. And she started on Mediterranean diet with a couple of caveats that was explained to her. So now the next follow-up visit, we saw her blood test. So she had a normal thyroid function, but in her food sensitivity test revealed a moderate to severe reaction to several food products. So she really didn't want to stay on the mitochondrial diet so much. So we had to, we kind of negotiated, because life is not perfect always. So we negotiated and we said, okay, so at least eliminate all these foods that are showing up as a high on your sensitivity test. And then guess what? Her vitamin D was 12 when the target is 50 to 80. So really low on vitamin D. And it's I just digress here. So many patients feel blasé during the winter months. And one of the reasons, not always exclusive reason, but it's a lack of vitamin D in their diet or in supplementation or just vitamin D deficiency. And sometimes just supplementing vitamin D to a level of 50 to 80 give people a great boost in the neurotransmitters and brain health. So back to Mary, her organic acid test shows some imbalances of the B vitamins, and they were supplemented accordingly with IV therapy as well as the oral therapy. And for people who are depleted in B vitamins, usually IV supplementation give them immediate boost of energy, and they feel significantly better. And guess what? Mary also had a positive ANA test, and the titers were pretty high, 1 to 320. That's pretty high titers. So she's definitely having some autoimmunity, or at least the beginning of it. So what we did, we improved her vitamin D. She came back for a follow-up in 8 weeks. And her vitamin D level was now 45 instead of 12. And then we reduced her dose from 10,000 a day to 5,000 a day. And at the same time, her ENA titers actually started decreasing from 320 to 280. But she still had some fatigue. And so we tested her for underlying infections and some digestive dysfunction. And what we found, that her GI function results show positive for yeast and parasites, in addition to the increased sensitivity to gluten. We measure this anti-gliadin secretory immunoglobulin A in our stool test, and if it's positive, it's a direct indication for gut permeability and gluten sensitivity. So some patients have a really hard time to give up gluten because it's so abundant in our diet. But when we see this result, either in their food sensitivity test or in the stool test, this is the hardcore evidence. So explaining and educating my patients about those results is a very important part of our mutual success, because if patients don't understand it, they will not be compliant with the diet or recommendations. So Mary was also placed on nutritional protocol for yeast and parasite treatments, which you usually take about from 4 to 10 weeks. And 8 weeks later, her new test result was showing that her vitamin D was even better. And her ANA actually was now converted to negative. So we resolved that inflammation and tissue destruction. And as a result, her non-specific autoimmune marker actually converted to normal. So patients who presented initially with the vague symptoms of fatigue could indicate many things, especially for her. She was a new mom. She could be thyroid function, could be mitochondrial dysfunction, could be chronic infections. Possibilities are actually, it's a pretty long list of possibilities for fatigue. But with the proper testing and the proper supplementation based on the findings, we can help people to resolve this long lagging symptoms of fatigue or lethargy or even depression. And patients usually see dramatic improvement in how they. So this is where our approach, functional medicine approach, is different from conventional medicine approach. We do take time and we make a huge effort to get through the history of the patient and create the timeline, because events in everybody's life can give us or clue us to the answers why they feel like they feel today. So I spend about 90 minutes with my patients, the new patients, to kind of understand and dissect the case and identify the red flags. And everybody's story is very different. That's why I need to really dive into case and understand what's really going on for that person. We patients, before they even come and see me, they fill out a very extensive evaluation and question. Upon their discussion and examining the patients, I usually order the test, and it might sometimes involve conventional labs, but usually we also gravitate towards the functional medicine testing that I just mentioned. Either it will be extensive infectious panel, or it will be organic acid test, or certain environmental toxin test, which can give us a clue where people stand at this moment. Do they have a chronic exposure to the toxins? Then we're going to be working on the environment. Do they have exposure to the mold, chronic infections? So patients usually get supplementation recommendations as well as lifestyle intervention prescriptions and some homework to learn about how lifestyle can affect their health. And so that's a very important part of the success for the patient is to do the homework and work with a health coach that we provide. Follow-up usually happens with the frequency of 6 to 8 weeks after the initial visit, and then maybe 2 to 3 months afterwards. And so since we are talking about mitochondrial dysfunction, I would like to introduce you to several products that I successfully use in my practice. So the glutathione precursor, which is N-acetylcysteine, omega-3 fatty acids that are so replaceable to quench the inflammation and improve their mitochondrial and cellular wall structure. And of course, the B complex, their B's complex, B's complete is a great and very comprehensive B vitamins with the methylated folic acid and B12, but also very elegantly and professionally balanced B vitamins. I do not recommend for people to take one isolated vitamin for a long period of time unless we see that it's a profound deficiency and might be genetic problem. For example, some people have a genetic problem with transportation of B12, and we need to give B12 on a regular basis. But usually people need the whole complex of B vitamins, everything from B1 to B12. So taking B complex is really essential for the good energy production. So feel free to take a picture with your phone of this QR code on the left side of the screen if you want to jump to to their supplement store where you can order this product with their discount. And then there's a two product that I really like and enjoy using for people with a more advanced mitochondrial dysfunction. The Mitocore is actually a pharmaceutically studied product. It was studied on HIV patients who developed mitochondrial dysfunction while being on the antiretroviral medication. So Bristol Myers Squibb, one of the pioneers pharmaceutical company that created antiretroviral medications for HIV, found that their patients are so fatigued that the virus is dead, but now they cannot function. The quality of life is really decreased because of the mitochondrial dysfunction. So they did the research and they found that Mitocore is one of their most comprehensive combination of their nutrients that can resuscitate mitochondria. So they did the clinical study on Mitocore, and it shows statistically significant improvement in energy production and the quality of life of those patients. Their other product, ATP 360, is another very comprehensive formula that is studied, clinically researched, but it's more indicated for people with their chronic Lyme, chronic infection, chronic ulcers. So both products are very effective, and I get good results. So it's very important. I just want to say a few words, and this is a recent study that looked at their product supplements purchased on Amazon that were claiming to enhance the immune system. And shockingly, almost close to a half of those products had inaccuracies in their labels. Another half was actually misbranded, and 9 of those products contained undisclosed components. So I would like to emphasize that our store, and we cherry-pick our supplements, and we recommend a very reputable places where you can purchase them, either on the store or in the full script that will be available for you if you are a patient. And you never know how the Amazon delivers this product, how they store this product. So instead of taking a chance, use the reputable sources. And so also I wanted to mention that many of you probably know about our IV suite, that where we're administering IV nutrients that can help with the hydration, detoxification, even things like recovering from the viral infections or jet lag, and so much more that IV therapy can do for you. So if you have never experienced it, feel free to talk to me about it or just schedule an appointment to our IV suite. And if you're interested to assess your own immune system and your own mitochondrial function, you can scan this QR code and sign up for the discovery call with our office, and we can tell you much more about how to become a patient or how to enhance and optimize your health. So this is another way to you can scan this and schedule discovery call. We actually find this practice to be very convenient for clients and for our staff, because you can plan to speak with one of our staff and designate 15 minutes without interruption and speak with some of my health coaches or with the front desk staff, so they can give you all their understanding of what does it take to become our patient or follow our treatment plan. And or you can just log into our live Q&A. And so if you do know some of your friends or family members who can benefit from our services, feel free to scan this QR code and make a referral. Maybe your friends would be happy to go through this evaluation and testing and understand why they're not feeling well. Or maybe they're feeling great and they want to feel even better. So we do work with a range of different clients, from optimization to working on genetic predisposition and helping people to understand how they can remain vibrant and healthy as long as possible. So with that, I'm going to open the floor for the questions. But before I do, feel free to log into my shop and get the 10% off the site-wide discount, which is pretty generous offer. You can order anything you want on a site with their 10% off. And this is the code that you can use.